Hi. We've been through week 3 where we studied ethics from a variety of perspectives, from the perspective of deep social values, and then kind of on an instrumental level where we were talking about the how does an organization through its web presence, for example, make its values known. I have 3 points from our week 3 that I'd like to punctuate. The first is that regarding the mission statements and what you can learn from an organization, it's been my experience recently that some organizations, and particularly government, will say that they are transparent and they're committed to openness, and then you go to their website and you have a devil of a time finding what you're looking for. That there is kind of a faux transparency, that where stuff that you'd really like to know about, some fresh data or something, or how they actually live their mission, is not available to you. So I think there's we have to have some wariness, and that there's some distance sometimes between an organization's stated values and how you can actually encounter them. Second thing I wanted to punch up was kind of the purpose of some of this. We have taught you that there are 4 main areas of public health ethics that we want you to look at: organizational ethics, professional ethics, research ethics, and social ethics. On the level of professional ethics and organizational ethics that were both kind of touched on through the VIDA, the Values Identification Audit process, in the run-up to that, we talked about codes and statements of values. And I just wanted to say something that I've been thinking about codes. When you have an aspirational statement that says you shall or you shan't or you shall not do something. If you're in an elevator with someone who works, let's say you're in a hospital or a healthcare organization, and you're in an elevator and somebody else is some employees are talking about a patient, you know that's a code violation, you know that's a HIPAA violation, and you know that's a big no-no. If you were the manager there, would you bring this to their attention from the standpoint of you violated code or you violated the rules? Or would you bring this to their attention on the basis of you risked harming someone's human dignity? You compromised their confidentiality and thereby did them an injury, even if it was theoretical. So I think the way you would like employees who would respond better, I think, to the second kind of argument rather than just you violated rules. That the reason we explore ethics within organizations and within our professions is not to have the formality of the rules. It's to have the conversations. It's to have the sense that ethics are important because we have obligations to each other in organizations. We have obligations to the public. We have obligations to each other. We have obligations to our either our clients or the people we interact with. At the base level, not to violate their human dignity, and at a higher level, to provide the best quality service that we can. Quality assurance is definitely an ethical